Hello everyone, welcome to the M3 Academy. In the INICET previous year questions based on the mnemonic discussion subject pharmacology. So here is your exact previous year question. A 30-year-old female taking treatment for the multibacillary leprosy, yes, developed reddish black discoloration on the face and the limb along with the pigmentation of the conjunctiva. Yes, he complained of the dryness and the scarring of the skin. Drug is most likely responsible. Yes, so answer is clofazimine. Yes, this is the exact previous year question of the INICET, and we are discussing this complete drug A to Z with the super easy mnemonics. So stay connected with the session and keep writing in the comment box the mnemonics. Yes. So first you can just revise the complete drug by the name of the clofazimine itself. Yes, each and every word of the clofazimine tell you that every important features of the clofazimine. So clofazimine, clofa means colors. Yes, clofa means colors. So this clofazimine is a dye which colors your face, your skin, your stool, your intestine. Yes, so clofazimine, clofa, clo means colors. So this is a color. This is the dye which doing the color is a side effect. Yes, so clofazimine colors leprosy bug and you too. Yes, so what is the spelling of the clofazimine? When you revise the spelling of the clofazimine and correlate with each word, you can easily revise the important aspect of this drug. Yes, now so C for conjunctival pigmentation, C for conjunctival pigmentation, C for cosmetic concern. Yes, obviously C for colors. So it colors the face, the eyes, the stool, and the hair. Yes, even tears. Yes, so you can remember clofazimine, the alphabet C remind you conjunctival pigmentation, cosmetic concern, and the colors. Yes, and L for you can remember leprostatic drug. Yes, this is a part of the MDT and the leprostatic drug. Yes, and used in the lepra reaction because it has a anti-inflammatory effect. Yes, due to anti-inflammatory effect, the use in the lepra reaction. Next is light sensitivity, means it causes the photosensitivity, phototoxicity as the side effect, and lag period means the 2 month in dapsone resistant mycobacterium leprae. Now so root is oral root because clofazimine O for oral root. So this is only active drug. Orange to red crystal causes an organ deposition. So drug deposited in the fat, in the macrophages, and in the intestine. Yes. So we will look the picture of the intestine where this drug is deposited. So you can remember 3O. Oral is a root. Orange to red crystal and organ deposition. Which organ? Fat, macrophage, and intestine. Now clofazimine F means facial skin discoloration, reddish black. Yes, F for fat deposition. Yes, and 50 to 100 mg capsule is there. Yes, so it available into 50 to 100 mg capsule. Now clofazimine alphabet A denote the acneiform eruptions. Yes, so acneiform eruption also known as the isomorphic acne or monomorphic acne. Some other drug like steroid, nicotinamide, OCP, this also causes this acneiform eruption. So in the acneiform eruption or the isomorphic or the monomorphic acne, all the lesion of the acne are in the common characteristic in the common form. Yes, common in the face and the trunk. So this is known as the acneiform eruption. Yes, anorexia is a side effect and it has an anti-inflammatory property. That's why the clofazimine used in the lepra reactions. Yes, now Z for zero CSF entry, or you can say clofazimine C for CSF, L for low. So low CSF entry or zero CSF entry, and you can remember zebra like discoloration means the cosmetic variation in the skin. I for intestinal symptoms, obviously nausea, pain, loose stool, and intestinal discoloration. It also inhibit the DNA template. Yes, so what is the mechanisms? So when you discover the alphabet M in the spelling, so M for mycobacterial membrane disruption, M for M for mitochondrial electron transport chain inhibition, or M for mycobacterial phospholipase A2 inhibition. So examiner can ask question like how many mechanism of this drug clofazimine. Yes, I for intermittent therapy is possible because T half is very long, 70 days, and obviously this is inflammation controller. And for not safe in pregnancy, not safe in early pregnancy, liver disease, the kidney disease. and it causes the nausea, and also it inhibit the efflux pump. Yes, so how many mechanism from the clofazimine is work? Yes, so you can remember M and the E. Yes, membrane disruption, mitochondrial ETC inhibition, and mycobacterial phospholipase A2 inhibition, and also you can remember efflux pump inhibition. So this is the full form of the clofazimine. After completing this session, you should write this full form yourself. Yes, so now what is the study notes related to this clofazimine? So clofazimine is a dye which is laprostatic and anti-inflammatory property. This belong to phenazine class, used in the MDP and occasionally used in the XDR-TB. Yes, mechanism we already discussed: interfere with the DNA function, alters membrane structure and transport function. Yes, disrupt the mitochondrial electron transport chain, membrane disruption, and mitochondrial and mycobacterial phospholipase A2 inhibition. Yes, also inhibit the potassium transport, generate hydrogen peroxide. Yes, and inhibit efflux pump. So there is a so many mechanism for the work of the clofazimine. Yes, so this is orally active drug, 40 to 70% absorption. Yes, accumulated in the macrophage. Each and every line can become as a one liner. Yes, as a one liner question. Yes, so clinical response is slower down than the dapsone. Yes, with the resistance developing in 1 to 3 years. Obviously, yes, brand name is clofazimine, etc. So clinical use, part of the MDT regimen, the leprosy. Yes, useful in lepra reaction because anti-inflammatory properties. What is the adverse effect? We already discussed. It causes a reddish black pigmentation of the skin, especially on the exposed areas. Yes, discoloration of the hair and the body secretion is also present, but this is harmless. It causes the dryness, itching, and scarring of the skin, acneiform eruption, phototoxicity, conjunctival pigmentation. In GI, it causes the nausea, anorexia, abdominal pain, weight loss, enteritis, and the loose stool. Yes, so symptoms improve with the meals and dose adjustment. Yes, so now you can see contraindications. So this drug avoid in the early pregnancy and the liver and kidney damage. Yes, so how this color discoloration is look like, you can see in this picture. This is reddish black pigmentation of the face and the exposed area. This is the picture of the intestine where you can see the deposited drug as a black color. Yes, so now time for the practice of the MCQ. So this is the multiple choice question. Which of the following is true about clofazimine pharmacokinetics? Yes, the first option is it is a short half life, allow daily dosing. Yes, so short half life नहीं होती इसकी 70 days. Yes, so it has a long half life, so intermittent dosing is required, not the daily dosing. Yes, rapid CSF penetration, this is not true. There is a low CSF penetration. Yes, now so next is accumulated in the macrophage and fat. Yes, correct. M for macrophages we already discussed. Yes, organ distribution. Administered IV for lepra reaction. Yeah, administered orally for the lepra reaction, not the IV, because we discussed the full form of the clofazimine. O for oral. So O for oral है तो फिर यहाँ पे lepra reaction में आप इसको oral दोगे. Yes, अपन ने organ deposition देखा था मैक्रोफेज में. नाउ तो इसके बाद नेक्स्ट क्वेश्चन है. क्वेश्चन आपके सामने है. क्लिनिकल इमेज शो डार्क पिगमेंटेशन ऑफ द फेस, हैंड एंड कंजक्टिवा ऑफ द लेप्रोसी पेशेंट फॉलोइंग फार्माकोलॉजिकल ट्रीटमेंट इज आल्सो सीन विद द ड्रग. यस, सो व्हाट इज द विद द ड्रग. सो मैकेनिज्म ऑफ एक्शन पूछते हैं. इनहिबिट माइकोलिक एसिड. यस, ये नहीं होता है. फोलिक एसिड को भी सिंथेसिस नहीं करता है. आरएनए पॉलीमरेज को भी इनहिबिट नहीं करता है. तो क्या आंसर यहाँ पे जाएगा? जनरेट हाइड्रोजन पेरोक्साइड एंड इंटरफेयर विद इलेक्ट्रॉन ट्रांसपोर्ट. यस, सो दिस क्लोफाजेमिन काफ़ी सारी मैकेनिज्म से काम करती है. आपको कमेंट सेक्शन में लिखना है क्लोफाजेमिन कितनी मैकेनिज्म से काम करती है. फुल फॉर्म अपन ने देखा है क्लोफाजेमिन का. यदि आप इसकी स्पेलिंग लिखते हैं, एक एक वर्ड को डिसेक्ट करते हैं, तो इसके ईच एंड एवरी पॉइंट को आप बता पाएंगे क्लोफाजेमिन कैसे काम करती है. यस, तो आपका होमवर्क यही है. इस सेशन के बाद में आपको खुद की हैंडराइटिंग में फ्लैश कार्ड बनाने हैं. की पूरी फुल फॉर्म लिखनी है. यदि आप एक बार देख के और एक बार बिना देख के इसकी फुल फॉर्म लिख लेंगे तो आपको पूरा टॉपिक याद हो जाएगा. यस, और इसके बाद यदि आप इसका फ्लैश कार्ड बना के हमको सबमिट करते हैं तो आपको अलग से मेंबर्स के ग्रुप में ऐड किया जाएगा, जहां पर काफ़ी डिस्कशन होता है. यस, जो वैल्यूएबल टॉपिक्स होता है उनका डिस्कशन होता है, वहाँ पर आपको ऐड किया जाएगा. आपको कुछ नहीं करना है, इस तरीके से फुल फॉर्म लिखनी है और आपको खुद को सोचना है क्लोफाजेमिन मीन्स कलर्स. यस, कलर करेगी हर जगह फेस का, का, सूल का, ईयर का, हेयर का और इंटेस्टाइन का कलर करेगी। यस, तो आपको याद आएगा कंजक्टिवा का कलर कर रही है, कॉस्मेटिक के यहाँ पर चीज़ें कर रही है। इसके अलावा एल से याद करोगे कि लेप्रोसी के लिए यूज़ है, लेप्रोस्टेटिक है, लेप्रा रिएक्शन में यूज़ है, लाइट्स ऐसे याद आएगा, फोटोटॉक्सिसिटी है, लेग पीरियड यहाँ पे ले रही है। यस, ओ से याद आएगा आपको ओरल यहाँ पे रूट है। यस, ऑरेंज रेड क्रिस्टल का री है, ऑर्गन में डिपोजिशन हो रहा है। यस, इसके अलावा एफ से याद आएगा आपको फैट में डिपोजिट है। यस, कितना कैप्सूल होता है, 50 to 100 mg का कैप्सूल होता है। तो ये सारी चीज़ें आपको इसके फुल फॉर्म से ही याद रहने वाली है। फिर भी आपको लगे कि ड्रग को रिलेट करने में कोई दिक्कत आ रही है तो आप हमें व्हाट्सएप पर मैसेज कर सकते हैं या कमेंट सेक्शन में भी लिख सकते हैं। यस, थैंक्स फॉर दी पार्टिसिपेशन।